Hey, what's up, everybody? Welcome back to another edition of DPH Clinical. I got the guys from Colorado Surgical Institute here. They just finished a course they just got done with, and we're going to talk about kind of some lessons that they learned and some things that they've kind of noticed from the students, and just kind of talk about some things that hold you back and how to get through them and just problems that everybody has. So I'll pass the mic to you guys. Just take it from there.
What's going on, man? It's good to be back. I'm putting my phone on do not disturb because every
There
time
you go.
I get a text or phone call, it kicks me
It's almost
off.
like we've done this before, you
Yeah,
know?
yeah. Well, I'll find a way to screw up the recording somehow, but I'll do my best after like our 20th go on this. So, yeah, we just wrapped up our wisdom tooth and single implant course. We actually did it out of Dr. Brisky's location. And I mean, awesome location. I'll let him kind of talk about his new build process if he wants to, throw any pearls in there. But one thing we did that I thought was really cool is the fourth day, we kind of all sat around this table he has in his conference room on the second level while all the patients are getting prepped and sedated or records or whatever the case may be. We just kind of went around table and talked about the things that were holding people up from implementation or what they viewed as the obstacles that they have. And as we went through it, everyone had like a slightly different take on it, but it all kind of boiled down to this sense of not being good enough to do a procedure, or not being as good as a specialist, or not being able to do this and charge full fee for it because there's a sense of guilt of charging a full fee for something that they're technically, quote unquote, still not as proficient at. It was just really interesting hearing people say it in a different way, but if you funnel it down to the base root of what it is just like, we want to do the right thing for the patients and we don't feel like we're good. And that's just how it is in the beginning, right? You need reps. And the common theme throughout this of understanding how to figure out the complexity of a procedure is getting reps on the procedure and getting reps in mentorship. And that's why that conversation was so profound for me. So, I mean, I know Dr. Brisky had a lot of takeaways from it, and we can go through each individual thing, but that's kind of what I wanted to talk about. It seems like it bugs everyone a little bit about not being really good at a procedure that we haven't done a whole lot. And I don't know if you guys have another solution outside of, well, you just got to get the repetitions in your practice to get good at it.
Yeah, I think that's a common thing, and we've always heard these phrases such as "jack of all trades is master of none," and I can't do it as good as the specialist, so that's below the standard of care. And I think these are all fear-based statements, and I guess there's some truth to them to some extent. But I think these are things people say when they're just scared. They're scared of doing it, and this is how they can say, "You know what? I don't need to do this because anyone who's doing this procedure is doing something wrong by the patient, and I want to do the right thing for my patient." And I think what it all boils down to is, yeah, we're not comfortable doing a procedure and we are scared to learn how to do the procedure. Like, I do a lot of specialist procedures. I do not do all on four surgery. I do not do what you guys do. But, molar endo, comp ortho. And after a while, you kind of realize that, you know what, my stuff's better than a lot of the specialists. That might be like patting myself on the back, but I guess what I'm saying is that I think we're all held to this ideal, this dental school ideal where everything's perfect. And if you send it to the specialist, it's perfect. It's not, man. Dentistry is not perfect. It never is. And teeth are unpredictable. And I think to expect that you're going to get perfection every time, and that's the only way that you can do these procedures, I think you're selling yourself short. What would you say, Brisky, that you noticed about the course, like building off of what Tahara was saying?
So the first day is always a look around the room, check your ego, figure out who's in the room, figure out what you can say that's okay. And then people kind of measure themselves to other people and compare each other a lot. I notice that quite often. So traditionally on day one, it's more of an easier start where we try not to pull too much from someone because they're not going to be willing to share it. I've learned over the past 12 courses. And then the second day, people lower their guard just a little bit, where it allows them to really learn a ton, which is really cool. So I found that to be much more profound learning as always on the second day. But everyone just compares themselves. I've seen a lot of people compare themselves to the person next to them, or to me and Dune, or to the specialist down the street. But the common themes are really, if everyone would just find a really good friend to learn these procedures with and to build confidence with. I told everyone in the room, hey, if anyone's from Colorado, don't be afraid to send me and Dune your mess up case. We won't judge you. We just won't. We're going to take care of you guys and send it back, right? But I think part of the fears is it's relationship building is the biggest fear for it. And then after the first day goes by, they notice that these procedures aren't as hard as they really think it was coming in. And then I was reviewing CTs of implants after the first day, at the end of the first day. And we were going through some singles, and we did a few full arches, like edentulous overdenture cases. And then I showed a few vertical sinus cases. Then at the end of it, I had one x-ray of one implant. And I said, hey guys, did you all realize that we reviewed all of these x-rays? And at the end, now this one implant that we're reviewing is just one implant. And you're all just shoving it to the side like, oh, that's just one implant. That's easy now. Right?
Yeah.
Like, oh, see? So now your mindset's growing. You thought this was scary. That one implant was scary. And then at the end of the first day, you're telling me that you're just brushing it to the side like you already did it. That's kind of crazy. So there's so many different personalities that we come across.
Yeah. And if we're going to get like tactical about it, and Paul, I think you hit the nail on the head when you talked about like a fear-based type of statement. But if we get tactical about it, right? I mean, you could do cases for free. Now, I'm not an advocate for doing anything for free. And I used to do this, right? This bleeding heart, I'll do it for free. I used to find that if there's no dollar associated with the procedure at all, that the patients will sometimes disrespect it to the point where it kind of tarnishes that relationship. It puts a bad taste in your mouth. It makes you not want to do it again. But I did find if you've charged at least the cost of doing the procedure, like calculate what the overall overhead for that case would be, including like payroll and labs and all that stuff, heating and cooling of the facility, then you can do the case for that fee. Now, you don't tell the patient that you're actually going to be, hey, I'm learning, unless they're a cool patient and that's something that you think that they feel comfortable hearing. But tell them like, look, we're doing a marketing push and marketing campaign. I think you got a really cool story. If you want to be part of this, what we can do for you is you can sign this release. We're going to record you before, during, after, 6 months after, and put together a marketing piece. And we're going to use you on social media, use it everywhere. You have to be okay with that. But if you are, and you allow us to do that, then we're going to give you a discount. And that's the way I like to give discounts to patients if I were to be learning a procedure, because it doesn't give like the sense to the patient that they may not be receiving the best care. And then that sense of guilt of like, okay, I'm not charging them full fee for the price will go away. You get more repetition doing the procedures. And on top of that, you're building your marketing campaign that you give to your marketing group to bring in more cases that are just like that as well. So you can add to the reps also. And that's what we advise a lot of people to do. And then part two is to find a mentor where you can run cases by them. So like Dr. Brisky and myself, I mean, I'm doing like 3 or 4 calls a day with our CSI, Colorado Surgical Institute alumni. And what we're doing is they're sending me like Trent just sent me and Brisky his full arch. And it was like awesome. Paffenroth.
Yeah, I know Trent.
Yeah, he actually listens to the podcast and he'll be like, man, that was a really good episode. And he'll text us every once in a while. But
what up, Trent?
And he just sent us this beautiful full arch that he just did. And if someone hits a complication, we're able to field those calls and text messages, and we'll do like a Zoom call or whatever, and we'll help them with it. So through doing the cases for less money and getting the repetitions, but then also following up with some of the struggles with mentors, it really helps move the needle.
Now, I'm just curious, what kind of dollar discounts are you offering to be a model? Do you call it modeling?
Oh, man. I don't call it modeling because not everyone would strike a pose type of thing. You know, I wouldn't see any blue steel. But
like a modeling contract. Do they sign a modeling contract? Like that says, no, I'm going to let you use? No?
They sign an ironclad release, man, because when we put stuff on TV commercials, like people can sue you for big bucks. So if you guys want, reach out to us, and I got a pretty good release. But no, I just say it's marketing. And what I would do is everyone's profitability in their practice is different. So look at your overhead and then calculate that for the procedure. If your overhead's 70%, calculate that. If your overhead's 33%, which is awesome, calculate that.
It's like when I started doing veneers, we were doing a lot of Mother's Day and charity contests. So we'd do a Mother's Day thing where people would write in, they say their story. We'd usually get like maybe 30 submissions, and then we'd meet like 10 people. And we'd usually do almost all of them. Like we were only supposed to pick one, but we just always wanted to do almost all of them. But what was great is that these were these like full mouth makeovers in which then when I was talking to my normal patients about it, I now had pictures. Now I got to show them, oh, we did this one. Oh, she was just in a situation just like you and this. And it's almost like you start to close more cases. One, you've got the chops and you could show it visually, but two, you're just more confident. And it's like you said with the reps thing. Coming back to what you said earlier, that the common thing was the fear that people have. They don't feel this like imposter syndrome. What do you think is the easiest way to overcome that? The mental part to say that I'm not good. Because I think that's it. I'm not good enough to do these cases. How do we overcome that? Other than getting the reps.
I think having community that supports you. And you said something earlier about like, okay, so if we look at this in like 4 blocks, complexity holds people back from doing it. And I think through education and mentorship, we can take care of complexity of a procedure. Now, dental culture, what we were taught in dental school, like, hey, specialists can only do this, generalists or GPs cannot. There was a time where putting your marketing out in the yellow pages was frowned upon and you were a pariah for doing that. And I think everyone listening to this nowadays would say, hey, that's an antiquated way of thinking. Well, guess what? GPs doing specialty procedures. I mean, the ship has sailed on that one. And that thought process, I believe, is antiquated or well on its way to being considered antiquated. So you need to surround yourself with a community of people who are in that super GP category or people doing advanced clinical procedures, because you guys will self-motivate each other, like Brisky said. Find a group of friends who you're going to do this with. So when the doubt starts setting in, you're going to talk to someone else and they're going to be like, no, dude, I feel the same way. Like when I was doing my first x-rays, I'd be pacing the hallways waiting for the x-ray film to develop so I could see if my implant was in the nerve or not, if my implant was in the sinus. There's always this sense. And even today, I mean, I'm doing sleep apnea treatment. I had a patient come in this morning and talk about, well, I don't think it's effective. I had that sense of doubt saying, well, what if he saw a physician and got a CPAP? What if he had a different doctor who's been doing sleep apnea for a decade treating him? Would they have a better result? Like it sets in until you get the repetitions to know that you're doing the right things. And so I reached out to my mentor who taught me sleep apnea. And she kind of just talks me through my cases to make me feel that I'm doing the right thing. And sometimes it's like I'm doing the right thing. I just need confirmation from someone who's done it more than me to realize that, yeah, you're doing the right thing. And that part in itself puts my mind at ease when I have those self-doubts.
Hey everyone, I just wanted to share a recent success story I just heard about. 6 months ago, Dr. Dushyant Patel of Sumner Dental Group in Tennessee reached out to Relevance Marketing because he wasn't receiving a whole lot of traffic from his website or anything online. Relevance expanded the online presence by listing the dental office in all the online directories with consistent information, which is super important, fixing any errors, along with redesigning his website using content that Google upranks, all the while keeping aesthetics and search keywords in mind. They then began to publish blogs and information relevant to dentistry using the search keywords for their area. Now, in just a few months, Sumner Dental was in position number 1 or number 2 on the Google Map Pack and organic listings for almost every single dental keyword. They saw an 88.9% increase in phone calls, as well as a 115% increase in interactions with their Google business profile. Now, if you think having your phone ring almost twice as often with new patients could really change your practice, well, you're right. If you're looking for a transparent, no contracts, no BS, and results-driven online marketing program, look no further than relevanceonlinemarketing.com. It's who I've been using for almost 5 years. Can't say enough good things about them. Hey, mention the Dental Practice Heroes podcast and you'll get your first month free. Go to relevanceonlinemarketing.com to schedule your free demo today. That's www.relevanceonlinemarketing.com.
I always like to think about the thing is like in dental school, we sit there and we work on typodonts, we do fillings, we do crowns, and we've got to have the perfect crown for our board exams and stuff like that. But man, you work on a real patient for that first time. Remember your like first crown prep? Like you went in there like you were doing like fucking heart surgery. You're like, dude, this is gonna, okay, I gotta review my clearances. I gotta review my axial. Okay, how many degrees is this supposed to be? You weren't prepared for that. I guess what I'm trying to say is you can only prepare so much until you just get in there and do it. We got to remember that we're never really ready for anything. There is no walking into a procedure for the first time again with a patient and feeling 100% not nervous at all. And I'll tell you, me placing implants, I think my hands still sometimes shake. And I got to be up there like 300 implants at this point. What the hell's up with that? Sometimes I just get nervous. I don't know. It just happens. What do you think, Brisky? I feel like we haven't heard from you. Are you okay?
Yeah, I'm good. I'm good. I just finished my 3rd week of the startup, and I had an entire 4 days of teaching implants and wisdom teeth right between it. So I haven't slept more than probably 4 hours any night in the past 3 weeks.
They look like you're sleeping right there. Like, come on.
I'm doing good. I'm just thinking about it when you guys are talking about these things.
Okay.
There's just a lot of commonalities between people defeating themselves in it.
Yeah, I think turning off that like internal narrator is important. And that's really it. It boils down to like, hey, find the right patients with the right case selection. If you don't know if it's the right case selection, reach out to someone who can help do that confirmation for you. Like, yeah, this is a slam dunk, dude. Do this case. And then do the case for that patient. And guess what you're going to find out? The success rates are very high. And those patients will come back and they don't want to see anyone else. They want to see you. They want to only know your team. They want to drive to one place. They want one financial plan. They don't want multiple lines of credit out there with Care Credit or Proceed Finance or whoever at multiple offices. At the end of the day, it builds your reputation in your community. If you're the one-stop shop, if people can come just see you, it's a reputation builder. Now, it doesn't happen overnight, but I had a dude who I just did his full arch on. His buddy came in from Walmart and was like, oh, yeah, you just did my buddy's teeth. And I saw you here, and I saw you here. It's like the branding and the reputation you build is because people are actually seeing my work around the community versus the crown or the wisdom teeth coming out where they're not walking billboards, essentially. So I would encourage anyone who wants to get into this game to get into it. And if we dovetail the conversation into profitability or revenue, which is always part of the equation, hopefully it's not the only motivating force, but for those of you who have a lot of student debt, maybe practice debt, whatever the case may be, these are higher paying procedures. And if you look at ortho, right, let's say you charge $6,000 for ortho, you do 5 starts a month. What is that? 300 grand in revenue for the year that you've added to your practice. Or if you do 5 wisdom teeth, 5 sets of wisdom teeth per month, and you charge $2,000 per month, what is that? That's 10 grand a month. That's $120,000 in revenue by doing 5 sets of wisdom teeth. And there's some people like Sean Custer who do 3 sets of wisdom teeth per hour, and he'll just do 6 hours of wisdom teeth in the day. And so that's what, 18 wisdom tooth cases in one day. You just factor it into like, hey, doing 5 a month, there's an extra $120,000 in wisdom teeth. So if you extrapolate that out through all the different procedure mixes, you're not going to be a master of none. You're just going to be very intentional about your case selection on the ones that you're picking. Do the ones where the revenue is going to be predictable and the complications and comorbidities and all this stuff can be low. And then you can start getting the reps and building your marketing and so on and so forth. It's always multifactorial. Like no decision that you're going to make is going to exist in a vacuum. So you have to weigh kind of everything at the same time. But it's awesome once you implement it into your practices. And these are the things that really take people to the next level.
Would you be willing to share how many arches you're typically doing in a month?
Yeah, so this month I have 11 scheduled. The double arch I was going to do yesterday, I made a mistake and I didn't get a blood pressure at our consultation. So she comes in, we hook up on the monitor and she's 230 over 130. And so she stayed that way for an hour. So we ended up just having her ride take her to the emergency room, get her back in with her physicians and get her BP checked and all that. But typically speaking, 10 to 12 a month. April was a freak type of month. I took a vacation and we're just striking out everywhere. And I only did 1 arch in April, and that's like not catastrophic, but really like bad for the office. But on average, anywhere from 8 to 12, 15 is probably the high end in terms of arches for myself.
That's amazing.
I closed 5 arches my first 3 weeks.
Wow.
What?
You haven't done well.
That's crazy, man.
Yeah. 4 arches and 1 combo case, so it needs like a denture first, then sinus lifts, and then arch after. Yeah, I closed 5 arches.
That's awesome.
My first 3 weeks. So I got a little comfort. It's not going to repeat the second month. But it happened. And I was very proud of that. Planning.
I'm proud of you. I'm proud of you, Brisky.
Thanks, man.
I'm proud of you. All right, so talk about what you guys got going on. What's coming up at CSI? We're here in June. This is going to be released. Yeah, this is actually going to be released next week. So June 22nd.
So if all goes well, we're going to have the new facility up and running at the end of July. We have our August full arch course that will be out of a new 12,000 square foot surgical facility. 18 ops on the main floor, lab and all the conference rooms and all the amenities and areas in the basement. And then we're going to be doing full arch. So the full arch is obviously upper and lower, some lateral sinuses, some block grafts, the digital workflow, the mills, the 3D printers. And the cool thing is we're going to have everything on site in one location. And then we might tie in some IV sedation as well. So that's going to be in August. The IV sedation course, the virtual curriculum sign-up component of it, we are starting registration now. So if anyone is interested, we got to take some small groups in the beginning. So sign up for the virtual component, we get you started, and then we kind of pair it up with your live patient clinicals. And a lot of that coordination and logistics is kind of hard to describe over a podcast, but reach out to us at coloradosurgicalinstitute.com and we can get you guys scheduled on that end. And of course, we got our single implants, vertical sinuses, wisdom teeth, the PRP, PRF, all that stuff, kind of all happening in conjunction too. So it's all coming together, man. This thing is really taken off, and I'm excited for the future.
I just want to remind anyone just like that's listening, that's doubting themselves, to just kind of give me a due and a phone call if you want to hear our journey along the way. It wasn't the easiest journey either, but just someone reach out if you ever want to chat about our journey, or if you're hesitant really just about integrating anything into your practice, give us a phone call so we can pump you up.
Awesome. Yeah. Brisky, if I've sent you a case and it was like a total screw up, would you be like, wow, would you like tell the patient that this was a really hard case, even if you didn't think it was a hard case?
No.
What?
Wait, well, maybe I didn't understand the question. I'm already thinking about cases in the past that people...
No, I'm thinking you should be like, oh man, back to actors. This was a really hard case, man. This is...
yeah.
Man, yeah. See?
Yeah, you tell them, oh my God, this is probably this is 99th percentile in terms of difficulty.
Yeah.
Right?
And then they'll be like, oh,
things went really, really well.
That's my luck. That's my luck. That's my whole life. That's what everybody always says. Totally, I should have known. I'll just share a story because we're running out of time. But I punted to an oral surgeon. I'm going to be completely honest. This was not that long ago. This might have been 4 or 5 years ago. So it was not like I was a new dentist. He troughed some buccal bone and popped that thing out in about 20 seconds and made me look like a complete ass. So...
Yeah.
So tip is we'll milk it
struggle a little bit.
Get your knee in the chest.
God, this is so hard.
That's great. All right. Thanks so much, guys. We'll talk to you next time. coloradosurgicalinstitute.com.
Hey, everybody. This is Dr. Dune from Colorado Surgical Institute. Just wanted to give you guys a shout out and let you know about the program. We have full arch surgeries. We have lateral sinus lifts. We have block grafting courses, all done in one weekend with the whole digital workflow with photogrammetry units, scanners, 3D printers, milling, you name it, anything regarded to full arch, we cover in depth. We also have a PGCA course. What that is, it's the Postgraduate Clinical Accelerator course, where we are going to be covering wisdom teeth, single implants, and it can be complex single implants with vertical sinus lifts. We'll also be covering full arch extractions with ridge reduction, bone grafting, PRP, suturing, and we also will have a course on socket preservation. So if you guys are interested in any of those courses, please reach out to us at Colorado Surgical Institute. The code is